Thank you, everyone, for being here today. I would like to thank Equalize for all their effort in helping me. And I would also like to give a special thanks to my mentor, Tori Gonzalez. She's just amazing. I cannot thank her enough. Um, I'm Arshia Khan, Professor and Director of Graduate Studies at the University of Minnesota Duluth, and I'm excited to talk about enhancing elderly and dementia care using humanoid robots, a human-centered approach. I'd like to start by introducing you to my lab, DECAS, which stands for Dementia and Elderly Care, Robotics, and Sensing. In my travels and conversations, I've discovered a common thread that most of the people that I come across and have conversations with have been touched by one or more of their loved ones being affected with dementia. This widespread impact emphasizes the need for the focus on human-centered care, where we place the well-being and the well-being of our loved ones at the forefront of all our efforts. My mission is to help these individuals and ensure that they can get quality care as they deserve. At DECAS, our mission is to advance the field of human-centered care through innovative robotics and sensing devices, specially tailored to support the elderly and individuals affected with dementia. My goal is to enhance the quality of care, thus improving the quality of life of all the people who are affected with dementia as well as the elderly. Today, I will be sharing some groundbreaking work that we have been doing through DECA's, our lab, and talking about how humanoid robots can help people who are affected with dementia and also elderly people. So I'd like to bring to attention a pressing global challenge, the aging population. By 2050, the number of people affected number of people age 80 and above would have tripled from 157 million in 2022 to 459 million in 2050. In tandem with this, people affected with dementia is also growing. We are expected to see an increase up to 139 million people affected with dementia by 2050. By the way, dementia is an umbrella term, which means it could be Alzheimer's, it could be vascular dementia, it could be Parkinson's, or any other form of dementia. Dementia is just an umbrella term. In addition to the aging population and the increase in the number of people affected with dementia, there is also a critical healthcare worker shortage. By 2033, we anticipate a shortage of 124,000 physicians, 200,000 nurses, and more than 400,000 home health aides. So, as our population is aging, the healthcare needs of elderly and people affected with dementia is becoming increasingly demanding, requiring 24/7 care. This puts a significant burden on our healthcare system as well as our caregivers. So what we need to do is think outside the box. We need to come up with innovative ways to help support our healthcare system. And one of those innovative ways could be robotics. Robotics have been transforming care. We've seen robotics in surgery, where they have been improving precision. We've seen robotics in rehab, where these robots have been able to provide targeted, consistent, and customizable therapy, accelerating recovery times and improving patient outcomes. And now my work has demonstrated that the humanoid robots can be effective in working with elderly and people affected with dementia. Humanoid robots have a great potential to serve elderly and people affected with dementia. They can facilitate social interaction, they can stimulate group activities, they can administer evidence-based therapies. These robots can enhance social engagement, provide cognitive stimulation, support physical and emotional well-being, and serve as companions and assistants. Currently, I have about 19 robots deployed in 10 different nursing homes across the country. And I have been conducting several clinical trials, which I have completed. Some clinical trials are underway. Here is a video of a robot working with a person one-on-one. This person is affected with dementia. So these robots can work one-on-one or in small groups, or they can work in large groups as well. So one of the apprehensions that I have often heard about is that our elderly have not grown up seeing robots. So are they afraid of these robots? To this day, I haven't come across a single elderly person or a person affected with dementia who has gotten scared with my robots. So we have gathered some groundbreaking data. We have conducted several 5 to 6 week long clinical trials at 3 different nursing homes. And these trials have proved that robot-assisted therapies can improve cognition, especially in the attention domain. To summarize, we have found that our studies have demonstrated improved cognition as measured by MoCA, which is Montreal Cognitive Assessment. Our studies also demonstrated that we have been able to improve mood, we have been able to reduce depression. So robot-assisted therapies are actually working. So if you're wondering what kind of data we gather, we of course gather pre and post surveys from the residents themselves, as well as the staff members. In addition to that, the unique thing about my work is we gather wearable sensor data, which is electrodermal activity data. So the EDA was used to measure the cognitive and emotional arousal. EDA is a valid, tested, and established mechanism to measure cognitive and emotional arousal. And you can see in the graph, the EDA can be decomposed into phasic and tonic. Phasic is the jagged blue edges, which is essentially a transient response, whereas the sustained response is the gray signal. That's the tonic signal, and that is the one we are often looking out for. And here you can see the average tonic mean of baseline versus therapy over sessions. And here you can see that we have been able to successfully arouse cognitively and emotionally all of our residents. So there is a lot of excitement around my work, as evidenced by a lot of media outlets that have done stories on the kind of work that my lab is doing. Recently, I got back from Geneva, where I was invited to speak at the Artificial Intelligence for Good Global Summit. This summit was organized by the United Nations, and my talk was very well received. I have been approached by 3 to 4 robotic companies to discuss potential partnership, recognizing the potential of my work. Several individuals and organizations have expressed interest in partnering with me. Several government officials from the European countries have approached me, showing keen interest in my work and its implications for policy and public sector applications. I have also been approached by angel investors. So when we are discussing the competition, of course, there are a lot of robotic companies that are building robots and working on having it interact in the real world. Another aspect of the competition is the human healthcare worker, However, there is a significant shortage of trained and adequately compensated workers in this field. During my interview with Anna Stewart for a series of this was a new episode of Decoded for CNN, where she interviewed me, and she posed this question to me that Japan has tried humanoid robots and they have not been very successful. Why do you think you will be successful? So my response is straightforward. My approach is working. I have evidence from clinical trials that show that humanoid robots can actually improve cognition, reduce depression, and improve the mood. Unlike others, my approach is not about fitting a robot into an existing scenario. Instead, I focus on understanding the specific needs of the people with dementia and tailor the applications to their needs. There are several factors that put me ahead of my competition. For instance, the recognition of my work, my successful clinical trials, the field experience. I'm not just playing in the labs. My robots have been out in the field since 2020. There is very high demand for my work, and I have attended a lot of meetings, international and national, and I have yet to encounter somebody who's doing the kind of work that I am doing. I'm very passionate about starting a business. My short-term goals are securing the intellectual property, building a strong, passionate team, a team that's as passionate for this work as I am, finding the right robotics partners. So my expertise lies in coding and understanding the human-robot interaction to get the results. I have applied to Equalize program because I want help. I need help in starting the business. I have the vision of how we can build healthcare, and I need help moving my academic enterprise into a business enterprise. Thank you.